Hi, I'm Dr. Amanda, and I'm an orthodontist. I'm also the CEO of StraightSmile Solutions. We help dentists all over the world understand orthodontics better. We work with all systems, braces, appliances, and brands of aligners, and we support all systems and brands. This video will share content that is the property of Invisalign and Align technology. We've made this video upon request of 40,000 plus doctors, subscribers, and followers to help them achieve better outcomes with their Invisalign cases. We do not work for Align technology. All opinions expressed in this video are the opinions of StraightSmile Solutions and not Align technology. Thank you to Align Technology for continuing to support us educating and helping their doctors and letting us share this video around the world through YouTube, Instagram, Facebook, TikTok, LinkedIn, and all of our social media platforms. Together, we unite to make more smiles. If you have questions or concerns about this video, please contact us directly at www.straightsmilesolutions.com. Enjoy the video.
This is Dr. Amanda with StraightSmile Solutions, and we're going to talk a little bit about hygiene and braces. And hygiene is critically important when you put braces or anything fixed on a child. It is really important, first of all, that they know how to floss, brush around the brackets and get in between and under the wire, but also that they're eating a proper diet during the braces. And this is just an example here of what can happen if the child does not adequately take care of their teeth with braces. I've had cases where you take the braces off and the enamel comes off with the brackets. Like the teeth literally fall apart when you debond them and they end up losing their teeth. So it is really important that doctors really keep an eye on the hygiene. And sometimes doctors are going to have to make the hard decision to remove the braces before the braces are done in order to not cause permanent damage to the teeth. So it's a hard decision. And I think a lot of times with parents, I feel like they paid for something and they're not getting it. But you are forming a partnership during the treatment and you have to keep up your care, your end of the bargain at home, which is the home care. And you got to keep in mind for the doctor's own personal liability, if they know that they're causing more harm than good to the patient by leaving the braces on, they're obligated to take those braces off or to discontinue the treatment. So I get a lot of questions about that. So hopefully that answers some questions. Hopefully that this picture will shock some of the kids and the families out there to see a little bit more why it's so important and so super critical to be brushing your teeth. Hey, I love aligners for teens. I think that it makes all the sense. And you are putting the compliance on the child to wear the aligners, but at least as long as they're not drinking sugary beverages with them in, at least you don't have the issues with the hygiene like this. So any questions, of course, subscribe to our YouTube channel. Visit StraightSmileSolutions.com and keep those.
Amanda here with StraightSmile Solutions, and we're going to be talking about cavities today. And I know you're thinking like, oh, StraightSmile Solutions is an orthodontic solution. Why are you talking to me about cavities? Well, we're talking about cavities because you should understand what a cavity is. It's important because if you're thinking about getting braces or aligners, you need to understand what decay is and how to prevent it. And make sure that all your teeth are healthy. So this is an example of a child that has severe decay. And usually this kind of decay you get in kids when they are drinking sugary beverages, either at nighttime in their bottle. That's the most common that you see, and a lot of people, they don't know that there's anything wrong with drinking juice or drinking milk all night long. So that's what you tend to see here. It is really sad for the child. So make sure that you are brushing your child's teeth. I know that when they're little, sometimes they don't like it, but you know better than them. You can make it really fun and just make it part of the regular nighttime routine. Hey, I've been there. I get it. Sometimes 2-year-olds like to protest anything, but you just make it part of what it is. It doesn't need to be painful. It doesn't need to be a battle. So, and hey, there's plenty of times you have to brush your kids' teeth for them if they're not doing it. And that goes for 10, 11, and 12-year-olds too sometimes. So make sure your kids have great oral hygiene, set them up for success in the future. Any questions, go to StraightSmile.
It's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com. And we've had a lot of questions come in, especially to our Facebook, patient-facing Facebook group. So this video is made for consumers, talking about cavities and deciding to go into orthodontics if you have cavities or even periodontal disease in your teeth, but mostly we're going to be talking about cavities. So it seems like there's still a lot of questions. A lot of the comments we're getting on our YouTube video that we did like a year or two ago is seems like people aren't understanding what a cavity is. So found this picture that I wanted to show you. And let's talk a little bit more about what a cavity is and why you shouldn't go into orthodontics if you have a cavity. So first question I got today was, how come I'm told I have a cavity, but my tooth doesn't hurt? So does that mean that it's okay? So my comment to that is, if you know anything about teeth and what they're made of, inside the tooth is a nerve, right? Just like you have nerves in your body, you have nerves in your tooth. It's an actual living thing. So like a tree, like a human, like an animal. So if the nerve dies, it's like the brain dying. So the tooth dies. If the tooth dies, sometimes there's a lot of pain that's associated with the slow death of the tooth or the quick death of the tooth if you have trauma or something like that. But sometimes you don't feel anything. It's just a really, really slow death and you don't even notice it. But the problem is, like anything that's dead, like if you like had a dead animal, if you ever had a dead animal in your roof or in your attic or in your basement, it's really stinky, right? For a while, it's gross. There's a lot of bacteria, there's a lot of decomposition going on. Same thing happens with a tooth. So even if you never felt it die, just having a dead thing that's in your body, there's all kinds of infections that can go on. And the infection could be little, it might go away, it might come back. It probably will never completely go away. It could be very serious. So the infection can infect other teeth next to it and can infect the bone. It can spread into your neck. It could collapse your airway. It can spread into your brain. So it can actually kill you. One dead tooth can kill you if it spreads and infects. And I know that seems like it's a huge stretch, but it's not. It actually can happen. It's very serious. Teeth infections can become very serious very quickly and they can kill. So it's really important. And then anytime you have something that's dead or dying or an infection and you're trying to move it around with braces or aligners, it's really bad. Not only you have an increased chance of like spreading the infection, but you can also have extreme discomfort if that flares up. And the tooth is also more brittle and more likely to break, and all kinds of other things. So we do not want to do, take home message, we do not want to do any orthodontics with a dead tooth, unless you've had a root canal and it's been sterilized and cleaned out, right? Or we don't want to do any orthodontics if you have a tooth that has decay that's big enough to become a problem. Sometimes if you have what we call incipient decay, that's just like a baby cavity, and those often can go away. If you really work on your hygiene, use a lot of fluoride, keep it really clean and healthy, sometimes it can build enamel back and it can actually, it's like a scar, it goes away. So, but that's why sometimes we put cavities with small cavities on watches and we say work on your hygiene, use fluoride, and it might go away. So, but unless it's that type of decay where the doctor says it's okay to proceed and he'll watch it, then you should definitely get all your dental work done before you go ahead with ortho. Also, to add, it's a lot more difficult with braces to brush and floss with the braces on. It's just more challenging. It takes longer. Most patients don't put the time and effort into it because it's just so time consuming. So cavities often get worse a lot quicker. It's harder to brush. And with aligners, we create what we call an anaerobic environment. And an anaerobic environment is, it's kind of like if you have like an infection or a cut, right? You want to kind of air it out. You want to make sure it stays clean, right? But if you just kind of don't clean it and it's in a humid and murky environment, it can get worse a lot quicker, right? And it can actually proliferate and propagate. So, not unlike, for example, an anaerobic environment, with infections or even with anything, any type of bacteria. You remember like science class. So we don't necessarily want you to start aligners if you have a cavity because it can make the cavity much worse very fast. And you might lose that tooth and worse, your health. So that's why you want to make sure you have your teeth and your gums and everything healthy before you start orthodontic treatment. All right. Hope that was helpful. Thanks so much. And just a tip, if you're in the US or in Canada, if you're looking for low cost cleanings and dental work, you should really consider your local dental school. So I know people don't like the idea of students, but often they have a sliding scale and sometimes they're completely free. So you might have a little bit of a slower student working on you. But from experience, they're all being supervised and graded. They do the best work of their life. You know, they really take time into what they do. Um, I think it was always a really positive experience when I was in dental school, and they really appreciate you being there. You get treated very well. So, you know, if finances are an issue and you've got some, you know, time and flexibility with your time, that's a really good idea to get everything you need. All right. Thanks so much. Amanda with StraightSmile Solutions, here to talk to you a little bit more about orthodontics, orthodontic cases. And today we're going to be talking about periodontal disease and braces, periodontal disease and Invisalign. We're going to be talking about what this means. And if you've been told you have periodontal disease, can you have braces or can you have Invisalign? And ultimately, let me go ahead and tell you a little bit more. And I'm showing this picture because I don't know if this guy has periodontal disease or not. I'm seeing signs of it that may lead me to think that maybe he does have it, but he may not. So what is periodontal disease? Periodontal disease is a disease or a breakdown of the periodontum, which basically means the attachment of the gums and the bone to the teeth. So we're all born with a certain level of gums and bone attachment. It's no different than if you plant a tree in your backyard. You have to have a lot of like dirt, right? Earth to keep it stabilized. And if you try to plant a really tall tree in just a tiny little pot, it's going to fall over, right? It's going to be kind of wiggly. It's not going to be stable. It's the same thing with teeth, right? Now, over time, our attachment or periodontum starts to disintegrate or break down. There are 80-year-olds with really healthy periodontum. They may have almost all their stability that they were born with. And part of this is due to genetics, and part of it is due to environmental factors. So there are certain things that you can do that will accelerate the breakdown of your periodontum. So for example, like smoking, like poor oral hygiene. If you have poor oral hygiene and you let calculus or tartar or plaque sit on the teeth, the acids will help to accelerate the breakdown. Once you have breakdown, it doesn't come back. All you can do is make the area more healthy so that there's no infection, so it doesn't continue to get worse. So you cannot grow your periodontum back. You can just make it more healthy so it's not getting worse, right? Once it's gone, it's gone. There are different surgeries and stuff that can add bone, add tissue, but that's a whole other story. So basically, I know that sounds super duper complicated. So you can get diagnosed with periodontal disease, but it could be active or it could be passive. That means if it's active, that means it's actively happening and you need to do something to stop it so that it doesn't get worse and make it healthy. So usually that means cleaning out the bacteria, cleaning out the plaque, cleaning out the calculus, cleaning out the food, removing any active infection. It might need some localized antibiotics, stuff like that. Okay. Also, if your bite is not healthy, or the alignment of your teeth is not healthy, this accelerates the breakdown of the periodontum. So that's why we do recommend braces or aligners for people with periodontal disease so they can get their bite and their teeth healthy. So back to this picture. That was a long example, but you can see in this picture that clearly this bite is not correct, right? So those front teeth, lower front teeth are supposed to be behind the upper front teeth because they've somehow got displaced, moved forward. Now the bite is incorrect, and I can flat out tell you this is accelerating the breakdown of the periodontum. So if this person already has active periodontal disease, this is going to get significantly less, and this patient will likely lose their teeth. So their lower front teeth over time, unless you A, correct the bite, or B, stabilize the periodontum, or most likely both. Anyways, so I think now you get the idea. So no, you cannot tell just from a picture if somebody has periodontal disease. You need your dentist to do lots of things. This will involve x-rays, a clinical exam, some measurements where they call out those numbers, all kinds of numbers, and there's healthy numbers and there's not so healthy numbers. And then you add all those things together and that tells you what's going on with the periodontal disease, okay? But everyone probably age 30, 40 has a little bit of periodontal disease. There's just past or present. It's just really hard not to, because it's just part of the aging process. It stinks, but it's just there. So, but hopefully we're all passive. But in any case, yes, you should get braces. You should get periodontal disease. If you do, you should get braces. You should get aligners. If you have periodontal disease, your dentist will need to keep more of an eye on the case, make sure everything's still healthy during the case. Sometimes it may mean that you may need a cleaning every 2 or 3 months. and a check during the braces. You may need a periodontist, that's a specialist of gums and bones, to keep an eye on your treatment to make sure everything's still healthy. So hopefully now you understand a little bit more about the importance of healthy teeth, bones, and gum during your orthodontic treatment. All right, any questions, let me know. Visit StraightSmileSolutions.com. I know that wasn't the most fun topic, but it's a really common question that I get on my website. So hopefully not only from patients, but also from doctors, and people don't quite understand it. So message me if you have any questions. Doctors, you're welcome to visit StraightSmileSolutions.com. Make an appointment for a complimentary consultation. If you're looking for support to accelerate growth of orthodontics in your practice, don't forget to visit us.
Today, we're going to be talking about periodontal disease. I know a lot of people are concerned how you get periodontal disease, how you get rid of periodontal disease, and what, if anything, you can do to improve periodontal disease. So this is just a kind of in-your-face example of what typical, I'd say, a severe periodontal disease patient looks like. This is a progressive disease, and it can start over time. Usually it starts just because you're maybe not taking care of your teeth so well. Plaque sits on the teeth and gums for a little while. There's an infection that happens as a result. That infection causes breakdown of the gums and the bone that support the teeth. And it's kind of like if you've planted a tree and you have, say, not that much dirt to support the tree, and maybe it's kind of washed away. Well, the tree is not going to be very stable and it might fall down, right? It's the same thing with teeth. So there are some surgeries and there are gum specialists called periodontists that can help to stop the progression of that disease, or with some medicine or some surgeries or some really keeping them clean. And sometimes there's some surgeries that can help to add bone or gum back on. They're pretty expensive and not that comfortable, but they are effective when you need them. So in any case, that's pretty much it. And, we're all about braces, orthodontics. What does periodontal disease have to do with that? Well, it has everything to do with that, because if you have periodontal disease, your teeth are not going to move like a healthy tooth. And it's really important for your dentist to know if you have periodontal disease. So that's about that. All right, thanks so much. Any questions? Keep them coming.
Hey, this is Dr. Amanda with StraightSmile Solutions, and keep those questions coming, those orthodontic questions. I had an awesome question today from a patient of one of my doctors. This was in South Carolina. The question was, and remember, all my answers are not a substitute for clinical judgment. You need to talk to your own doctor about your particular scenario. These are just generalized answers for you to educate yourself. I'd rather you come to me than come to WebMD or just searching the internet, because my answers are correct. So, at least I think they are. But in any case, the question was, can I do braces or clear aligners or Invisalign or Damon or whatever we're going to call it with a cavity or with untreated gum disease? First of all, you need to talk to your dentist about that, because my answer would be no, that's probably not the best choice. Your dentist needs to examine the area. There are certain levels of cavities and gum disease that are kind of dangerous and not so dangerous. Does that make sense? Some that can be reversible, some that can't be reversible without treatment. So you need to get more information on your particular medical situation or dental situation. But just a generalized answer would be, from a scientific standpoint, if you have a cavity, okay, some little tiny cavities can actually be reversed. If you brush, floss, use fluoride, okay, they can actually re-mineralize. That's great news. My personal experience and my understanding of the scientific studies is this is more likely to happen in just an regular oral environment, not an oral environment where you're putting a hot trapped piece of plastic over it, because that actually perpetuates more anaerobic bacteria. Anaerobic bacteria can affect the health of your gums and your teeth. So my answer would be no, I don't think I would recommend doing aligners, Invisalign, braces, anything like that with a cavity. That's just my opinion, but talk to your dentist, because they will take a specific look at that particular situation and assess it. Number 2, should I do aligners, braces, whatever, Invisalign with untreated gum disease? Basically the same answer. So some types of gum disease could be very easily reversible in a matter of days. I mean, sometimes you have an area you didn't floss, it's bleeding a little bit, you floss it, you clean it, and it goes away, right? Yay. So sometimes you have an area that needs a surgery in order to fix it, or needs scaling root planing, which is a type of surgery. And then a lot of additional medications or anything like that. So in that situation, probably not would be my answer. So always connect with your dentist, get more information, get as much information as possible, get those gum readings, take a look at the x-ray and discuss all your risks, benefits, and alternatives. If your dentist has any questions about orthodontics in general, please have them visit StraightSmileSolutions.com.
Amanda with StraightSmile Solutions here to talk to you a little bit more about orthodontics, orthodontic cases. And today we're going to be talking about periodontal disease and braces, periodontal disease and Invisalign. We're going to be talking about what this means. And if you've been told you have periodontal disease, can you have braces or can you have Invisalign? And ultimately, let me go ahead and tell you a little bit more. And I'm showing this picture because I don't know if this guy has periodontal disease or not. I'm seeing signs of it that may lead me to think that maybe he does have it, but he may not. So what is periodontal disease? Periodontal disease is a disease or a breakdown of the periodontum, which basically means the attachment of the gums and the bone to the teeth. So we're all born with a certain level of gums and bone attachment. It's no different than if you plant a tree in your backyard. You have to have a lot of dirt, right? Earth to keep it stabilized. And if you try to plant a really tall tree in just a tiny little pot, it's going to fall over, right? It's going to be kind of wiggly. It's not going to be stable. It's the same thing with teeth, right? Now, over time, our attachment or periodontum starts to disintegrate or break down. There are 80-year-olds with really healthy periodontum. They may have almost all their stability that they were born with. And part of this is due to genetics, and part of it is due to environmental factors. So there are certain things that you can do that will accelerate the breakdown of your periodontum. So for example, like smoking, like poor oral hygiene. If you have poor oral hygiene and you let calculus or tartar or plaque sit on the teeth, the acids will help to accelerate the breakdown. Once you have breakdown, it doesn't come back. All you can do is make the area more healthy so that there's no infection, so it doesn't continue to get worse. So you cannot grow your periodontum back. You can just make it more healthy so it's not getting worse, right? Once it's gone, it's gone. There are different surgeries and stuff that can add bone, add tissue, but that's a whole other story. So basically, I know that sounds super duper complicated. So you can get diagnosed with periodontal disease, but it could be active or it could be passive. That means if it's active, that means it's actively happening and you need to do something to stop it so that it doesn't get worse and make it healthy. So usually that means cleaning out the bacteria, cleaning out the plaque, cleaning out the calculus, cleaning out the food, removing any active infection. It might need some localized antibiotics, stuff like that. Okay. Also, if your bite is not healthy, or the alignment of your teeth is not healthy, this accelerates the breakdown of the periodontum. So that's why we do recommend braces or aligners for people with periodontal disease so they can get their bite and their teeth healthy. So back to this picture. That was a long example, but you can see in this picture that clearly this bite is not correct, right? So those lower front teeth are supposed to be behind the upper front teeth because they've somehow got displaced, moved forward. Now the bite is incorrect, and I can flat out tell you this is accelerating the breakdown of the periodontum. So if this person already has active periodontal disease, this is going to get significantly less, and this patient will likely lose their teeth. So their lower front teeth over time, unless you A, correct the bite, or B, stabilize the periodontum, or most likely both. Anyways, so I think now you get the idea. So no, you cannot tell just from a picture if somebody has periodontal disease. You need your dentist to do lots of things. This will involve x-rays, a clinical exam, some measurements where they call out those numbers, all kinds of numbers, and there's healthy numbers and there's not so healthy numbers. And then you add all those things together and that tells you what's going on with the periodontal disease, okay? But everyone probably age 30, 40 has a little bit of periodontal disease. There's just past or present. It's just really hard not to, because it's just part of the aging process. It stinks, but it's just there. So, but hopefully we're all passive. But in any case, yes, you should get braces. You should get periodontal disease. You should get braces. You should get aligners. If you have periodontal disease, your dentist will need to keep more of an eye on the case, make sure everything's still healthy during the case. Sometimes it may mean that you may need a cleaning every 2 or 3 months and a check during the braces. You may need a periodontal dentist that's a specialist of gums and bones to keep an eye on your treatment to make sure everything's still healthy. So hopefully now you understand a little bit more about the importance of healthy teeth, bones, and gum during your orthodontic treatment. All right, any questions, let me know. Visit StraightSmileSolutions.com. I know that wasn't the most fun topic, but it's a really common question that I get on my website. So hopefully not only from patients, but also from doctors, and people don't quite understand it. So message me if you have any questions. Doctors, you're welcome to visit StraightSmileSolutions.com. Make an appointment for a complimentary consultation. If you're looking for support to accelerate growth of orthodontics in your practice, don't forget to visit us. All right, have a great day. Thanks.
And we're here today to talk about my favorite things for oral hygiene. Whether you have aligners or braces or whatever you have, these are some of my favorite tools here. So I kind of want to go over what I have and why I recommend them. And I apologize, this is my daughter's bathroom and it's not that clean. There's nail polish everywhere. But in any case, this is the stuff we use in our house. So we have a Sonicare toothbrush. We have a cordless water pick. We have always Act only mouthwash because it has fluoride in it. Not Listerine, none of the other ones. No Scope because it doesn't have alcohol and doesn't have essential oils, so it won't affect the braces or the attachments or stain or denature your appliances. A tongue scraper and a tiny little itty bitty toothbrush as well to get into those crevices. Of course, floss as well. I don't know why that's not here, but in any case, these are the things we like. Obviously, you're going to use your Sonicare twice a day for 2 minutes minimum. Your water pick, you can take it to the shower with you and clean all your teeth and your aligners out if you have aligners. The mouthwash, you can actually dilute it and put it into your water pick. Tongue scraper should be done at least 2 times a day. And the itty bitty toothbrush to get all around those little aligners or inside your teeth. So hopefully that helps. These are the things I recommend. It can be a little bit of an investment. The cool thing about the water pick is that you can exchange the tips. The same thing with the Sonicare. So you can share it with multiple people as long as you pull your brush head or your tip off. So it is an investment of a couple $100, but you will have much healthier teeth afterwards and better outcomes with your braces or aligner therapy. So in any case, hopefully that helps. These are things I would go buy before you start your ortho treatment. All right. Thanks so much. Bye-bye.
Hi, I'm Dr. Amanda, and I'm an orthodontist. I'm also the CEO of StraightSmile Solutions. We help dentists all over the world understand orthodontics better. We work with all systems, braces, appliances, and brands of aligners, and we support all systems and brands. This video will share content that is the property of Invisalign and Align Technology. We've made this video upon request of 40,000 plus doctors, subscribers, and followers to help them achieve better outcomes with their Invisalign cases. We do not work for Align Technology. All opinions expressed in this video are the opinions of StraightSmile Solutions and not Align Technology. Thank you to Align Technology for continuing to support us educating and helping their doctors and letting us share this video around the world through YouTube, Instagram, Facebook, TikTok, LinkedIn, and all of our social media platforms. Together, we unite to make more smiles. If you have questions or concerns about this video, please contact us directly at www.straightsmilesolutions.com. Enjoy the video.